Good morning and welcome to the Department of Family and Support Services Expanded Shelter Re-Release RFP webinar. Just a few housekeeping rules. Due to the volume of participants, everyone has been placed on mute. Please submit questions via the questions box and we'll respond to questions at the midpoint and end of the presentation. For technical issues, please make use of the question box to notify us. Please be advised that this webinar is being recorded and anything stated at this webinar is not intended to change the solicitation document. Any changes will be in writing in the form of an addendum issued by the Department of Family and Support Services. The purpose of this webinar is to provide information for the solicitation. A copy of the recording will be posted to the DFSS YouTube channel with a link to the recording, and the PDF of the PowerPoint slides will be posted to the DFSS webpage at chicago.gov under the alerts and or funding opportunities tabs. This will take up to 5 business days. DFSS retains the right to share a list of registrants to this webinar along with their contact and organizational information at our discretion. At this time, we're going to go through our introductions. I want to give the floor to the program team.
Hi all. Thank you all for joining this webinar. My name is Alejandra Magaña, and I'm one of the directors here for the Homeless Service team at DFSS, and I'll pass it over to my colleague, Natalia.
Hi, everyone. Good morning. My name is Natalia Santillan. I'm a project manager here for Homeless Services and work with Alex's team. Thank you for joining.
And hi, everyone. My name is Jillian Black. I am the procurement proposal coordinator. And at this time, we're going to discuss the purpose of the RFP, the background, information about the scope and program description, selection criteria, the timeline, technical assistance, and then one last round for questions. And at this time, I'm going to pass it back over to the program team.
Hi, everyone. So the purpose of the Expanded Shelters re-release RFP is, we're going to cover that now. DFSS, the Homeless Services Division, is looking for applicants to operate a shelter program that will serve people experiencing homelessness in an already located hotel setting. The shelter program will support clients experiencing homelessness in moving to appropriate and stable permanent housing while providing them a safe, accessible place to stay in the interim. DFSS is seeking applicants to meet the shelter needs of families with children under 18, those fleeing domestic violence, and other family populations with specialized needs. Next slide, please. A little bit of background on this RFP. In April of 2025, the Homeless Services Division issued the Expanded Shelters RFP, which was number 53646. This is the prior RFP where DFSS sought applicants to take over the shelter operations for 2 standing shelter locations, which was the Midway Shelter to serve singles, and then the South DuSable Shelter to serve families with minor children. No awards were made under this RFP, the Expanded Shelters initial RFP. Therefore, the DFSS is issuing this current RFP, which covers only the Midway Shelter site to serve families with minor children. Next slide, please. So some goals of the Expanded Shelter Re-Release RFP. DFSS is seeking providers to operate a shelter program in an already located hotel setting, which will serve families with children under age of 18 that are experiencing homelessness. This shelter program will serve households with diverse needs and varying cultural backgrounds, helping them transition to stable, permanent housing while offering a safe and accessible place to stay in the interim. The shelter will receive referrals through 311 in coordination with the Centralized Shelter Intake, Transportation, and Crisis Response Program, and really the Emergency Homelessness Assessment and Response Center for families. Selected providers will work to stabilize families by providing case management services that will help them obtain identification and benefits, navigate housing options, and connect to community resources that support both securing and maintaining housing. This includes addressing a range of needs such as physical, legal, mental, emotional, and financial through a trauma-informed approach. The selected shelter provider should also recognize that each client's case is unique, and in turn, each client's path to stable housing can differ. Respondents must have a clear plan for reducing barriers to accessing shelter. This includes ensuring immediate shelter availability to those in need, maintaining high utilization rates to ensure access for all clients needing placement, managing a safe environment that offers voluntary supportive services, and ultimately connecting clients to permanent housing in the way that best suits their needs. Policies and procedures within the shelter should put the client and their self-determination first and should integrate understanding of the ways in which a client's prior trauma and experiences may impact their readiness and willingness to engage in services. All clients should be encouraged and supported to participate in services both in-house and through established partner referrals. Next slide, please. So for current state and priorities for improvement, in 2024, community partners, city and state officials, and people with lived experience began meeting as part of the One System initiative to create an equitable, integrated system to serve anyone experiencing homelessness, regardless of how long they have been in the United States. Through a series of international meetings, recommendations were drafted and finalized for a comprehensive homeless system with a focus on the following areas: shelter access, community integration, data needs, provider and services coordination, shelter and training. On October of 2024, Mayor Brandon Johnson announced the end of the New Arrivals mission and the transition to one unified shelter system to begin on January 1st, 2025. This transition folded roughly 3,800 beds from the New Arrivals mission into the regular homeless shelter system. Scoring of respondents' application for this RFP will be impacted by how clearly respondents can articulate their plans to integrate strategies necessary to address these areas for improvement in their day-to-day operations and long-term strategic planning with clients. Priorities for improvement include expanding equitable access to shelter, decreasing length of stay, improving rehousing outcomes. Additionally, DFSS seeks providers who can balance the need to provide a physically and emotionally safe space for all clients, while also having the ability to recognize and respond to the unique needs of each client. Providers should develop policies and practices that integrate client self-determination and attempt to mitigate harm while allowing clients to still make their own choices. DFSS encourages all providers to use a low barrier of an approach as possible, in alignment with the policies and practices described above, while still maintaining appropriate safety precautions to protect clients, staff, volunteers, and neighbors. Low barrier shelters implement strategies and practices like removing curfews, accommodating pets, accommodating couples, and accepting clients under the influence of drugs and alcohol. Next slide, please. For target population, the target population for this RFP is families with children under 18 years of age that are experiencing homelessness in accordance with the Federal Homeless Emergency Assistance and Rapid Transition to Housing definition. This can include households consisting of one or more adults with children under 18. The population experiencing homelessness in Chicago can also disproportionately includes individuals in the following groups who can face particularly high barriers to accessing services and housing, including persons with limited English proficiency. In recent years, Spanish, Creole, French, and Polish speakers have been most common. Persons on the sex offender registry, persons living with disabilities, persons with justice-involved backgrounds, persons who identify as LGBTQ+, people who identify as Latin American indigenous people, survivors of gender-based violence, and recent immigrants to the United States. Next slide, please. So for program requirements, DFSS seeks proposals from a qualified agency to take over 24/7 operations of the Midway Shelter Program in the facility listed below, and assume shelter operations by June 1st, 2026. The length and timing of the ramp-up period will be determined by DFSS, but the awarded agency will need to be prepared to assume full operations within 30 days. And again, the facility name is Midway Shelter. It is located at 7353 South Cicero Avenue. Bed capacity between 550 and 750. And again, the population that we're looking to serve is families with children under 18. The selected applicant will need to enter into an operating agreement with the ownership of the facility to continue operating in the space. Current agreement terms for the Midway Shelter site can be found in the Appendix B of the RFP. Additionally, the selected applicant will be required to work with the ownership of the facility on the zoning application to rezone the property for shelter use. The application will include basic information about the delegate, including organizational details and general staffing information. While the facility owner will take the lead in preparing and submitting the application, the owner will need to incorporate this general delegate information as part of the submission. And additionally, the rezoning process will require submitting an application for a special use permit through the City of Chicago Zoning Board of Appeals. Next slide, please. The shelter must deliver the following services, which reflect the essential elements defined in the Chicago Continuum of Care program model chart. Provide a safe environment, open 24/7 to people of all backgrounds, with a place to sleep, free of charge, and with a low barrier to entry. DFSS will prioritize respondents who will hire staff with the appropriate staffing qualifications to best serve the population in need, such as having licensed clinical social workers, LCSWs, and those who have experience working with the target population. Staffing should also support meeting residents' language needs, and DFSS encourages hiring day-to-day shelter staff with English and multilingual language skills to meet the language access needs of the target population. The selected respondent must also provide basic needs like meals, showers and toiletries, laundry, clothing, bus cards, hygiene kits, welcome kits, and limited storage. And the applicant must engage in diversion and outmigration efforts through coordination with system-wide diversion efforts or by use of creative problem-solving conversations at shelter entry to empower clients facing imminent homelessness to avoid shelter and return immediately to housing. Respondent must also provide connection to housing options by supporting clients in completing the Coordinated Entry System or CES housing assessment, either directly or through referral, and supporting clients in identifying and navigating other housing options, either directly or through referral. For example, working with clients to create housing plans, search for affordable and appropriate units, completing housing applications, and navigating the move-in process. Next slide, please. The applicant must provide on-site case management services to ensure clients are linked to services and community resources that will help them obtain or maintain housing, such as building income, building independent living skills, developing educational and career paths, developing language proficiency, addressing a variety of physical, mental, emotional, and other needs that may not be provided by the agency. Basic needs should be assessed at entry into shelter, and case managers should create individualized service plans to help identify unique needs and track progress towards personal goals. Case managers should be on site and must have must develop strong and individualized service plans and ensure that service needs are met. Case management should ensure clients are linked to services and community resources that will help them obtain or maintain housing, such as building independent living skills, accessing childcare, legal services, developing education and career paths, addressing a variety of physical, mental, emotional, and other needs. Selected agency will also be responsible for utilizing their own case management system to collect, store, and report on case management activities, referrals, and resident progress. Providers must have a plan for addressing challenges of operating a hotel-motel program, such as having individuals in hotel-motel programs. That experience can sometimes feel isolating, and so the provider must have the ability to navigate those difficult experiences in their services. Providers must act as active partners with healthcare providers to offer on-site primary and behavioral health care services to meet the needs of residents, building on the shelter-based service teams model developed with the Chicago Department of Public Health. Next slide, please. Program requirements continued. Under health and safety, the provider must ensure that the facility is in compliance with applicable local building, fire, environmental health, and safety standards and regulations which apply to the safe operation of the site. The provider must maintain minimum safety, sanitation, and privacy standards at the shelter facility sites. And here we have reference federal guidelines for shelter and housing standards. Provider must submit a quarterly bed bug certification to DFSS. Provider must protect clients and reduce the spread of infectious diseases through the implementation of CDPH guidance and public health orders issued by the Chicago Department for Public Health. And then all delegate agencies that handle food must have appropriate staff with a food handler certification. The provider must ensure language access for non-English speaking residents is met either through staffing or other means. Provider must inform participants of their rights, responsibilities, and expectations upon intake into shelter. The provider must not discriminate based on race, religion, national origin, sexual orientation, disability, gender, or family composition. Provider must provide placement and accommodation in accordance with the individual's gender identity. Must not require clients participate in any religious services or other forms of religious expression. The provider must provide reasonable accommodations for disabilities, and the provider must make all programming client-centered and voluntary for participants. For written requirements, the provider must have written policies and procedures for intake, client grievance, client discharge, and how conflicts and other crises will be addressed and resolved. Programs must submit current or proposed disciplinary policies regarding discharges or bans from their site to DFSS for review. These policies and procedures should comply with DFSS and the Continuum of Care's values. DFSS is committed to working with providers to ensure written policies and procedures match system values and goals. And the provider must notify the DFSS program manager in writing of any changes to staff, facility location, scope of services, or bed capacity. And for performance goals and outcomes, DFSS will monitor a set of performance indicators for all shelter types that may include, but are not limited to, the following: the percentage of participants who exit shelter to a more stable housing destination, the percent of participants who exit shelter to a permanent housing destination, percentage of participants who maintain or increase income, and that's including employment income or benefits, and then the percentage of participants with completed coordinated entry system assessments. Next slide, please. Okay. Selection criteria. DFSS will evaluate applications based on the following criteria: the ability to provide detailed evidence, examples that demonstrate an understanding of the population that applicant plans to serve and is specific on the population's strengths, assets, and challenges and needs. The respondent's leadership reflects and/or directly engages the people of the communities it serves, and that the respondent describes specific mechanisms by which client feedback is incorporated into service delivery. And this is under the community involvement selection criteria. Next slide, please. Under organizational capacity, DFSS will evaluate applications based on the following: respondent providing a full list of essential positions, personnel in the areas mentioned, and qualifications for each position, such as licensed clinical social workers, and tying those positions directly into the service delivery model for the client population, and providing detail about the hiring, onboarding, and integration of new staff into the organization for the program. The respondent must show that they understand the need for staff with language proficiencies. The respondent must describe a robust infrastructure around fiscal monitoring for their organization, and that the respondent clearly describes how they would scale to operate and has a plan for staffing up quickly. Respondent has specific policies or infrastructure to support speedy hiring and onboarding, which includes a 30-day transition plan. The next selection criteria is the strength of proposed program. Under this criteria, DFSS will evaluate respondents on the ability to describe their program model in detail, and tying specific elements of the program, such as case management, avenues for service provisions, to the core needs of the RFP and the target population. Respondents easily describing the client's journey from start to conclusion of the program, recognizing how the program would meet the client's unique needs. Respondent giving specific examples of how they will incorporate the mentioned evidence and best practices for this program model. Direct connections should be made between respondents' programming and the Continuum of Care's core values. We want to see respondents speak to how they would identify client needs, tailoring plans for case management plans, outside service referrals, and how they would keep clients engaged and working towards their goals. Respondent details the way in which partner agencies will participate in specific aspects of the program and provide named examples of agencies where agreements already exist or are in process. Details in the ways in which the program would maintain high utilization rates and how programs would avoid conflicts or discharges on site with the goal of retaining clients on site. Next slide, please. Under performance management and outcomes, the DFSS will evaluate applications based on the following criteria. The respondent demonstrates evidence of strong past performance against desired outcome goals and performance metrics and/or other notable accomplishments in providing services to the target population. The respondent has experience using data to inform and improve its services or practices. The respondent describes a system of data capture that would allow for desired analysis and speaks to their ability and action steps for disaggregating data consistently and systematically. And then that the respondent has relevant systems and processes needed to collect and store key participant and performance data. Under reasonable costs, budget justification, and leverage of funds, DFSS will evaluate applications based on the following criteria: that the respondent has the fiscal capacity to implement the proposed program, and that the respondent demonstrates reasonable implementation costs and funding requests relative to its financial and human resources. The proposed budget supports the proposed scope of work and accounts for all expenses in the proposed program. And so attachments that are requested under the RFP, we need to please do include your liability insurance, board member identification, your stamp certificate, your certificate of good standing from the state of Illinois, bylaws and articles of incorporation, financial statements, IRS termination letter, and of course your budget forms. Next slide, please. For the evaluation process, applications will be evaluated on the strengths of the proposal and to the responsiveness to and the responsiveness to the selection criteria. Failure to submit a completed proposal or responding fully to all of the requirements may make your submission subject to rejection. The DFSS commissioner, upon review of recommended agencies, may reject, deny, or recommend agencies that have applied for grants based on previous performance and/or other area needs. And then DFSS reserves the right to ensure that all mandated services are available citywide and provided in a linguistically and culturally appropriate manner. In order to ensure respondents can accurately respond to this request for proposal, DFSS is offering an opportunity to visit the Midway Shelter. The site visit will occur March 25th, which is tomorrow, from 10 a.m. through 11 a.m. Applicants are not required to attend the visit, but it is highly encouraged. Respondents must register for the site visit by filling out a brief form, which is linked below. Please do register if you are interested by Tuesday, the 24th, which is today by noon. Attendance is limited to no more than 2 people per agency. And again, here's the link, and the link is also available on the RFP. And a quick review on our timeline. The pre-proposal webinar is taking place today, Tuesday, March 24th. The site visit is tomorrow, Wednesday, March 25th. The due date to submit the pre-proposal questions. So if you have any questions that inform your application, please submit them to us by March 27th, 2026. The applications are due Monday, April 13th by noon, and then the program period begins July 1st of this year. The term of the contract. The term of the contract executed under this RFP will be from July 1st, 2026 through June 30th, 2027. Based on need, availability of funds, and contractor performance, DFSS may extend this term for up to 4 times, with each extension not to exceed 1 year. The amount for this RFP for 1 year is $5,821,750 through $7,938,750. And that's between the 550 and the 750 bed capacity. Please do submit a budget for 1 year, which should capture the total of 12 months for all services. And the respondent is required to incur and pay expenses before seeking reimbursement from the city. However, advances for costs will be considered according to the city's advance payment policy. Applicants who are interested in the advance payment option will need to indicate if they want to exercise this in the RFP. Cost category definitions are attached as budget instructions in every RFP. Be thoughtful and inclusive when developing your budget. Apply for your program's actual costs. As a general rule, DFSS cannot give applicants more money than what is requested in the budget form. Please do use the reasonable cost question on the application to discuss how you determine the costs reflected in the budget. Next slide, please. So some common errors for the budget proposals. Common mistakes that we see are fringes. Please do check your calculations. Under supplies, these are frequently under or over budgeted for. Under client assistance, if this is an appropriate and allowable cost, please don't forget to include it. Make sure your job description titles and your job description uploads have the same title. Also do put a brief description of the job in the budget document itself. If you have not discussed it specifically in your application, and then put your budget in the appropriate column, and please do show your programs match. And then finally, for the deadline, applications are due Monday, April 13th at noon, and that's noon Central Standard Time. And yeah, thank you. I'm going to hand the mic back to Jillian. Thank you.
Thanks, Natalia. Just a couple of application tips. We can't stress it enough to start your application as early as possible and save it as you go along as often as possible. If you have never done business with the City of Chicago, please register into iSupplier as soon as possible. Please review your RFP narrative and the application questions closely. And please remember that they align with the scope and the selection criteria. Please use the information in the RFP for guidance in formulating your answers. There is a 4,000 character limit, which includes punctuations and spaces for each response. And each response is allotted 4,000 characters. Please try not to use the back button on your browser. You could potentially lose your work. Some tips for working in e-procurement. To submit multiple applications for an RFP, applicants will need to set up a unique user account in iSupplier. The e-procurement system is not capable of submitting more than one distinct proposal per associated email address. Therefore, you must use a separate email address for each submission. And you can submit your application and later amend it up until the due date of April 13th at 12 noon. Please be advised that once it hits 12 noon, no other applications can be accepted. The application's time period shuts down, and there's nothing that we can do once it shuts down. So please be mindful of that. And we strongly encourage applicants to avoid the rush and possible mishaps by submitting early. And plan on your submission taking approximately 30 to 60 minutes. Again, late applications cannot be accepted. And we also encourage applicants to make use of the e-procurement hotline for help. The number is 312-744-4357. And they also can be contacted via email at customersupport@citychicago.org. For the hotline, please note that operates during business hours only, which is Monday through Friday, 9 a.m. to 5 p.m. And again, we strongly encourage applicants to save often as you're working on your application and submit as early as possible. Just a few agency requirements. We require agencies to provide articles of incorporation and any amended articles of incorporation. We also require an IRS affirmation letter, which is for not-for-profit agencies only. Please note that this letter must be dated within 60 days of submission. You can obtain this letter by calling the IRS directly at 1-877-829-5500. If you are a for-profit agency, please submit your original letter from the IRS showing your FEIN number. The UEI number is required, as well as the central contractor registration. And a copy can be provided from the entity overview page on the sam.gov website. And lastly, a certificate of good standing letter with the state of Illinois is required. As of April 2024, we have a labor peace agreement ordinance which applies to all DFSS and CBP-DH delegates that have 20 or more employees working for their organization. The only exemption are hospitals. Contractor must provide written notice to the commissioner or her designee within 72 hours of becoming aware that employees want to organize or that a union seeks to represent employees. You may ask, what is an LPA? A labor peace agreement ordinance is an agreement between an employer and a labor union that ensures that an organizing drive is not impacted by union busting techniques, including employee retaliation. And in return, they will not strike or stop work in a way that will impact human services. For technical assistance on the DFSS webpage, there will be a link to the RFP and training documents. Please see the alerts section on our website. And for questions on registration and e-procurement technical assistance for delegate agencies, please contact customer support at cityofchicago.org. And they also can be reached via phone at 312-744-4357. And for training materials, which includes documents and videos, please check the City of Chicago website under DPS, iSupplier, and then online training materials. At this time, we're going to delve into how to enter your responses and accepting amendments. The first step in creating your response, you select Create Quote from the drop-down menu in the Actions box, and then you click on Go. That will take you to the application page where you can get started. If the RFP you are interested in has been amended, and in this case it will be, you will need to acknowledge and accept the amendment to start or submit your response. To accept the amendment, click on View Amendment History. To begin the acceptance and acknowledgement process, follow these steps after clicking View Amendment History. First, you click on the document number. Next, you click on the infinity or eyeglass icon to review the amended changes to the RFP. And lastly, you click on the Acknowledge Amendments button to acknowledge receipt and understanding of the changes to proceed. And by acknowledging the amendment, you are indicating that you are aware of the changes made to the RFP in the amendment. When you get to the screen that looks like this, you click on the I accept checkbox, and then you click on Acknowledge. Next, you click on Yes to indicate that you confirm your acknowledgement of the amendment. Finally, you click on the checkbox that you accept terms and conditions, and then click on Accept to accept the terms. And that is the final step in acknowledging and accepting the amendment. Once the amendment is accepted, you can move forward with working and submitting your application. When you are ready to submit, meaning that you've answered all of the requirement questions, that you've attached all required documents, you can start by saving your draft one last time and then clicking Continue. If you are missing information, iSupplier will give you an error message at the top of the screen, similar to what you see here. And usually the error messages directs to something left undone in the application. So in that last example, the error message indicated that the lines found under the Lines tab had not been completed. In this example, the error is about an unanswered question in the application or the requirement section. The quote value refers to your, in this case, missing answer. Once your application is free from errors, you are ready to proceed and submit. And at that point, clicking Continue should put your application in the review and submit phase. Once you get to the summary screen, this will be your last chance to review all of your data to confirm that everything is accurate. Please double check all attachments and all responses and scroll down to the bottom of the screen to see all of your responses. And at the very bottom of the screen, you will be asked to provide an electronic signature. Please be sure to fill in the signature before checking the box. Once you've checked everything, you can finally click submit. When your application is successfully submitted, you will receive this submittal confirmation. The e-procurement system will send a confirmation email as well within 24 hours of your submission. However, please feel free to call or email me if you desire confirmation prior to then. Again, my name is Jillian Black. My email is jillian.black@cityofchicago.org. And at this time, we're gonna pause for questions. If we have any questions, I don't see anything as of yet. But if you don't have any questions, if you happen to have any questions after this webinar, the program captains, the RFP captains information is on the screen, as well as the e-procurement hotline contact information. And again, the question deadline is Friday, March 27th, 2026. And before we close out, does anyone on the program team have anything to add? Oh, I actually see one question that just came through. It says, can the grantee rehab any part of the building?
Yeah, great question. The lease negotiation will be entered with the building owner. So that would be a conversation to have with them directly.
Thank you. That appears to be the only question we have at this time. So before we close out, I wanted to give, oh, actually, there's another question. Alejandro, do you see it?
Yes, definitely. The question is, can you share why this was reissued and there were no awards last time? Yes, so for this one specifically, as kind of mentioned in the earlier slide, Midway was, the previous RFP was for singles. So as Homeless Services continues to kind of evaluate the system needs, this was now re-released with the target population of families instead of singles.
There's a couple other questions coming through.
Question is, has the building owner stated minimum agreement amount? Please, we'll have an answer for this in the amendment. So just urge you to kind of look at that one. We just have to confirm some information with that. And then the other question, would that rehab be a part of the budget? The budget itself, I know, has different line items, and some of them are for program operations, supplies, and all that. I think it very much depends on the conversation that is had with the building owner, but we can provide additional info in the amendment.
There's like two other questions.
Yes. Question, previously the bed rate was 129 bed rate. Why the significant drop in rate? I believe the 129 is referring to the previous release. At that point, it was kind of released during some new arrivals operations. And now as we're folding into the homeless service, operations, everything is aligning with the bed rates that we have within homeless services, which indicates the $29 bed rate on the RFP. The other questions, can this be isolated for DV? I think just for clarification, am I kind of hearing like just solely taking referrals for DB beds? If that is the case, we can provide additional information in the amendment.
There's one more question.
Next question is, since we would not be the owners of the building, would there be a lease between our agency and the building owner? That is correct. The delegate would enter into an agreement with the building owner.
Okay, thank you. Does the program team have anything to add before we close out?
No, nothing additional. Thank you all for your time and participating today. Please, if you have any additional questions, email the link posted here to your RFP captain, Natalia, who's on this webinar. And just a reminder, the deadline for submission is this Friday, March 27, for the amendments.
Thank you all for attending our RFP webinar, and good luck and enjoy the rest of your day. Thank you.